Good morning, good afternoon, and good evening, everyone. We are very excited to welcome you to this webinar, Inclusion and Equity for All, Resources Supporting Inclusion of Sexual and Gender Minority People in Global Family Planning and Sexual and Reproductive Health Research Programs and Services. My name is Brooke Huffman, and I am a Program Officer at the Johns Hopkins Center for Communication Programs. I'm joined today by colleagues and partners at CCP, USAID, Agency for All, and the Young and Alive Initiative. But before I pass the microphone to today's presenters, I'd like to quickly go over a couple housekeeping items. So depending on the version of Zoom you have, your screen might look a little bit different than this, and also if you're joining by computer or phone. But for today's webinar, we'll mainly be using the chat and question and answer function, which should appear as options at the bottom of your screen. We request that you enter questions for the panel discussion later in the session through the question and answer function to ensure that we see them rather than in the chat, and we'll remind you about that later. Slide. We also have French interpretation provided by Camila Aparicio, and it's already active. You can access it by clicking on the little circle that says interpretation at the bottom of your screen. Slide. You can also access this if you're joining via your phone by going to meeting controls in the little ellipses icon and selecting French interpretation. I'd also like to note that this webinar will be recorded and shared by the Breakthrough Action Project. Slide. Danette, I'll pass it over to you.
Thank you so much, Brooke. And I'd just like to let everyone know that even if you are going to use English, it's still important that you click on English via the interpretation feature. My name is Danette Wilkins, and I am so pleased to be with you all today. I'm just going to introduce a couple of key terms and definitions before we turn to our opening remarks. So one term that you'll encounter today is SOGIESC, which stands for sexual orientation, gender identity, gender expression, and sex characteristics. Next slide, please. And two other terms that you'll hear us use interchangeably or differently are SGM and LGBTQI+. So SGM, as you might have already noticed, stands for sexual and gender minority. And we use this term to refer to people whose sexual orientation, gender identity, gender expression, and/or sex characteristics depart from the prevailing sex-gender binary that assumes that heterosexuality and being cisgender are the norm. We'll also be using the term LGBTQI+. This acronym refers to lesbian, gay, bisexual, transgender, queer, intersex, and other individuals. This acronym and its embedded terms originate in high-income countries, so its use and application should be decided in consultation with people and other people with diverse SOGIESC in the local context. Those are the key terms and definitions that we want to introduce you all as we kick off this webinar. At this time, I'd like to now transition to our opening remarks. Next slide, please. So today we're going to hear from Shyami de Silva, who is the Director for the Office of Population and Reproductive Health with the United States Agency of International Development. Next slide, please. Shyami, over to you, and thank you so much for being with us today.
Thank you. So good morning, good afternoon, and good evening. I want to thank all of you for joining today's webinar, and many thanks also to Breakthrough Action and Agency for All for organizing this discussion today. This conversation feels particularly timely at this moment as we are reflecting on and celebrating the 30th anniversary of the International Conference on Population and Development, or ICPD, which was held in 1994. ICPD was really a watershed moment in our field for many reasons, not the least of which was underscoring the importance of meaningful inclusion and creating a global consensus that sustainable development rests in part on empowering all people to make their own informed and voluntary health decisions, including decisions related to family planning and reproductive health. I wanted to take a moment to touch on how the focus of today's webinar connects to the current priorities and focus of USAID's Family Planning and Reproductive Health Program. Our office recently launched a framework that outlines the direction of USAID's Family Planning and Reproductive Health Program through 2030, entitled Pathways to Progress for Sexual and Reproductive Health. And in this document, we articulate our overall goal for the program, which is to work with partner countries to realize a world where ongoing improvements to sexual and reproductive health contribute to longer, healthier, and more prosperous lives for all. Our work focuses on expanding access to high-quality health services, promoting healthy behaviors, broadening the availability of contraceptives, and strengthening policies and systems to address a range of family planning and reproductive health needs. To reach the goal that I just described, we focus on opportunities at multiple levels. So the individual level, health systems level, and the broader societal level, with some key objectives in mind. First, to ensure that all individuals have the information, skills, and ability to achieve the highest attainable levels of sexual and reproductive health. Second, to strengthen health systems to provide quality, accessible, and people-centered sexual and reproductive health care. And third, to foster positive social and gender norms and policies that support full agency in making sexual and reproductive health decisions. Our efforts are rooted in the principles of inclusive development and built on the understanding that every individual and community of all diverse identities and experiences is instrumental in the transformation of their own societies. The work we will hear about today is evidence-driven. It's based on community-led participatory research, and it expands the evidence base to help donors, researchers, and practitioners better understand, design, and deliver more inclusive family planning and sexual and reproductive health programs and services. The Agency for All project seeks to improve and sustain the health of women, girls, and communities through locally led, equitable partnerships. And today they will provide an overview of community-inspired guidelines and recommendations for USAID-supported family planning and reproductive health service delivery programs and research activities to intentionally include transgender and gender diverse people. The Breakthrough Action Project will share their assessment of the gaps in family planning and sexual and reproductive health programming for sexual and gender minority youth, how these programs can contribute to greater acceptance of these youth among families and communities, and how providers can offer more respectful, affirming, and competent sexual and reproductive health information and services. So I hope you'll find today's presentations insightful and enlightening, and that you will find opportunities to apply what you hear today in your own work. Thank you again for joining us today.
Shyami, thank you so much for those inspiring words that really serve as a call to action to all of us. And we hope that these resources that we'll share with you all today will guide you in the work that you're doing around the world. So first, we'll hear from Agency for All and two resources that they've developed that can support our work in being more inclusive in FP-SRH research and services. I'd like to introduce Sonal Gianni, who works with the Agency for All team and is also in a leadership role with the International Planned Parenthood Federation. Sonal, over to you.
Thank you so much, Danny. Please allow me a moment to share my slide. Hi, everybody. My name is Sonal Gianni, and I work with the International Planned Parenthood Federation as a Senior Advisor, Gender and Inclusion. And I'm here to present, two technical briefs that we created as Agency for through Agency for All, and to tell you a little bit about what the Agency for All is. Agency for All is essentially a collaborative project. It's a 5-year USAID funded project. And essentially it works on generating evidence on the role of agency in effective social and behavior change programming to improve health and well-being of for individuals and communities. The overall goal of the Agency for All project is to improve and sustain health and agency for individuals and communities. And we do this through locally led, equitable partnerships, which are focused on understanding agency within the social and behavior change programs. These inclusion guidelines that I'm going to tell you about, before that, I would like to answer the question that why are they even needed? Why do we need inclusive guidelines? Let me tell you that, when it comes to service delivery, the healthcare needs of transgender and non-binary people are very often ignored and they're not fully met. Even though there is new technology that is helping, we still really don't know enough about how to improve their healthcare. And this means that very often they don't get the care that they need. When we talk about research, transgender and gender diverse people face a unique problem. They are often included in studies that don't really focus on their specific needs, health needs. And hence they are sometimes left out of very important health research as well. The way we are measuring gender in studies can also erase their identities. Plus, when you talk about research, it's rarely designed or controlled by the transgender community. So it doesn't always reflect their true needs. So, of course, that's the reason that we created these technical guidelines. So as part of this project, there were 2 guidelines that were created through a collaborative effort by the University of California, San Diego Center on Gender Equity and Health, and the International Planned Parenthood Federation and USAID under this Agency for All project. These inclusion technical briefs are 2 distinct, but they are related documents. One focuses on clinical aspects and the other focuses on research. These briefs are designed for USAID and its implementing partners in low and middle income countries. However, they are very universal to use. The main goal is to review what has worked so far and provide guidelines to integrate inclusivity into existing as well as new programs. These briefs, they offer practical recommendations and they highlight successful strategies that could be adapted to different contexts. And we've made sure that both high income and low middle income country evidence is included. So the principles demonstrated would be effective across various settings. And the contents of these technical briefs were developed through a really highly consultative process, including a review of peer-reviewed and guiding literature from international bodies, together with deep input and expertise from key informants and stakeholder consultations. So first I will take you through the service delivery technical brief and the recommendations that are provided in this brief. I'm kind of giving you like a snapshot of the document. They're essentially divided into 3 parts. The first area is around family planning and SRH services. So first of all, when we talk about services, it's very important that family planning services are tailored, to this community. Individuals from the community, they still have the ability to conceive and could experience unplanned pregnancies. And so it's important that health providers need to offer inclusive counseling and understand how hormones and contraceptives interact, especially for people on hormone therapy. It's important to also provide information on fertility and pregnancy without making any assumptions, ensuring that, the discussions, they are always respectful and supportive. Additionally, when it comes to services for gender-based violence, we need to be aware of the unique types of violence that transgender and gender diverse people often face. This actually includes harassment, physical and sexual violence, and even violence from family members or authorities. So providing compassionate and immediate support along with a very clear referral pathways is very crucial. In the second area, it's important that to ensure transgender and gender diverse people, they are feeling safe in health facilities. And to make them feel safe in health facilities, we need very strong anti-discrimination policies and confidentiality. We also need to remember to protect the healthcare providers from violence and constantly remember to use respectful language. When it comes to making facilities more welcoming, you could, do basic things like just displaying inclusive signs like the transgender or rainbow flags and having like trained providers wear badges. In hostile areas, of course, you could use more discreet signs, but try to avoid gendered language that excludes people. It's also important to have gender neutral spaces like waiting areas and bathrooms instead of just women's or men's labels, and this may helps really make everybody feel comfortable. Finally, intake forms should let patients specify their name and pronouns much earlier on. So we should ask separately about sex assigned at birth and gender identity. And do update the health records to use the preferred name and pronouns, through the process of the service delivery. The third area, when it comes to client interactions, we find that many health providers, they don't really get enough training on how to care for transgender and gender diverse clients because there are restrictive policies and there are limited resources. So we need interactive training, if possible, with transgender trainers and community groups to focus on how to respectfully interact, especially for all staff. And using, you may not believe it, but actually using the correct name and pronouns makes a really big difference. And, the staff could introduce themselves with their name and pronouns, and then they could ask clients for this. And like I said before, this should be consistent throughout the client's care. And always our client should be able to make healthcare decisions freely and without pressure. So we need to provide all the necessary information and we have to respect their choices. We need to also recognize and address trauma impacts by creating a safe and supportive environment. Training providers to be trauma informed can really help mitigate the stress and improve care for transgender individuals. And it's crucial to respect transgender clients by using appropriate language and avoiding any kind of intrusive questions. Let's not make any assumptions about the gender identity or medical needs. Just follow their lead on sensitive topics to just ensure respectful and affirming interactions. The second guideline is the research one, the research-related technical brief. And again, it's also grouped into 3 sections. The first section being around research design. So when starting any research, it's important to really work closely with the transgender and gender diverse individuals and organizations. They can really help decide what really needs to be researched, the best ways that you can do it, and how to use the results. And so you should include them in the initial research to identify your study's focus and methods. And ethical approval is also crucial, so we know that the research is benefiting the community, and including them, especially in the leadership roles, is essential. We are finding like this traditional research is often excluding transgender individuals by using binary gender questions. So we should use inclusive language and avoid assumptions about gender or sex characteristics. So it's important to ask questions in a way that everyone feels represented, including asking about both sex assigned at birth and then the gender identity separately. And lastly, we need to address the lack of data that's often caused by narrow research methodologies. This means like using inclusive practices and ensuring that our sample is always reflecting diverse experiences. So instead of broad categories, we should allow people to identify themselves accurately. Larger, diverse samples will help create a fuller picture, and involving the transgender individuals themselves, TGD individuals in the research process itself ensures that the experiences are properly represented. Area 2 is around data collection. Training data collectors is crucial because transgender and gender diverse individuals have often faced very high rates of trauma. So we need to create a safe environment where they feel comfortable sharing their experiences. So ideally, recruit data collectors from these communities or ensure they have proper training and understanding. And when we recruit the participants, include a wide range of transgender and gender diverse individuals to ensure that our findings represent the whole community. We must build relationships with the community. So be transparent about who's involved, why, and use diverse strategies to reach people who are often missed. And it's vital to protect the safety and privacy throughout the research, especially when we are in places where they face stigma or legal issues. So conduct risk assessments beforehand. Have trusted contacts for the participants to express their concerns and provide support services like counseling. Again, getting informed consent is standard, but it must be done with sensitivity. So use inclusive language, explain the risks and the benefits very clearly, and provide fair compensation for their participation. Finally, when it comes to the third area, data analysis and the interpretation. So when analyzing data, let's not exclude again these communities. Sometimes the data is left out due to like small sample size or analyzed because it's being analyzed by sex assigned at birth. So we need to be clear about this, especially when we are getting the consent itself. And important to use respectful and inclusive language in the report. Avoid any terms that pathologize or judge the individuals, transgender, gender diverse individuals. And you can consult the community to ensure that the language is appropriate and empowering. And finally, when you share the results, involve the community to ensure that the findings are actually benefiting them. You can involve them in reviewing and presenting the research findings. You could also collaborate with local trans researchers and acknowledge their contributions. Ensure that the dissemination efforts do not pose any risk to participants by considering all these factors early on. I'll encourage you to read our detailed technical briefs to learn more about the development process and the additional recommendations. The links to these briefs are shared in the chat, and thank you for your time and attention.
Thank you so much, Sonal. And I am back with you all right now to present on breakthrough actions work. So I'll be presenting today on advancing inclusion of sexual and gender minority youth and family planning and sexual and reproductive health programs. And I just want to note that this is a joint effort. You can see the names and organizations on your screens. And I'm so grateful to everyone that was involved in bringing this to fruition. Next slide, please. For those of you who are not familiar with Breakthrough Action, it's an 8-year cooperative agreement that's funded by the U.S. Agency for International Development to lead social and behavior change programming around the world. And we do this work in partnership with other organizations like Save the Children, Think Place, and Ideas 42, just to name a few. Next slide, please. So for our focus in this area, we are really interested in understanding the state of inclusion of sexual and gender minority youth in FP-SRH programs. And what we learned from the start is that these programs, be in high-income countries or low and middle-income countries, prioritize the lived experiences of cisgender and heterosexual people in relationships. As a result, they have limited focus on the lived experiences of sexual and gender minority people, with the main exception being HIV/AIDS. And we see the same prioritization and focus reflected in programs that are aimed at youth. So what this tells us is that sexual and gender minority youth are underserved and need respectful, affirming, and competent healthcare. Contextualizing these health disparities within the context of a region or country is so important to be able to further clarify why it is that SGM people and youth experience health issues and outcomes that are both similar and different from their cisgender and heterosexual counterparts. Next slide, please. So to develop this brief, we similarly underwent a very participatory process. We started with a desk review to understand from the published literature, whether it was peer-reviewed or gray, what actually is being done. We then conducted an online survey in English and French to be able to poll people from around the world and understand what it is from their programming that they've been able to do and better understand their different contexts. We later co-hosted a concurrent session at the Women Deliver Conference last year with Agency for All and Health Development Initiative Rwanda. And this session allowed us to validate our preliminary findings and also continue to fill in some of the gaps that we'd identified. We then held a virtual learning series in partnership with Young and Alive Initiative. And this virtual learning series allowed us to truly solidify the insights from all of these learning and assessment activities and also then develop the actions that would be the recommendations for what can be done going forward to design and implement more inclusive and equitable programming. And you'll see these insights and actions reflected in the technical brief that I will speak to now. And that technical brief was also developed in partnership with Young and Alive Initiative. Next slide, please. So this technical brief, it's aimed at program implementers who are working at the intersection of family planning and sexual reproductive health, positive youth development, and social behavior change, or otherwise working to improve FPSRH access and outcomes among youth in low and middle income countries. Its purpose is to summarize these insights that we gained from these and then provide priority actions that you all can then apply to the design and implementation of programs. It's currently available in English, and we're working to finalize the French translation. So please stay tuned for that. Next slide, please. So I'd like to share with you some of our insights, and then I'll share the actions. I won't speak to each of these because we want to encourage you to review the brief, but I'd like to highlight a few of the insights. Importantly, stigma, prejudice, discrimination, and violence profoundly impact SGM youth's access to family planning and sexual reproductive health, as well as their outcomes. When we think about what they experience, we notice that they're at higher risk for STI transmission and unintended pregnancy. And they're also at higher risks for sexual and gender-based violence. There are also very specific forms of sexual and gender-based violence that are specific to individuals who are sexual and gender minorities. These include conversion therapy and corrective rape, both of which aim to coerce people into changing or suppressing an aspect of their SOGS that is considered to not be the norm. So it's really important when working with SGMU to understand that while they have many experiences that are similar to other youth, they also have very unique experiences that deserve attention and focus. We also learned about the limited access to respectful, affirming, and competent FPSRH education and care. And as you all might imagine, this profoundly impacts SGM youth's body and health literacy, as well as their bodily and reproductive autonomy. SGM youth have limited opportunities to learn about themselves, their bodies, and their right to health from trained educational and health professionals. They often also have limited financial resources to be able to access care due to limited opportunities for income generation. Another insight is around the individuals in the lives of SGM youth. They have a significant influence on their access and outcomes. We learned from our learning and assessment activities that SGM youth can often risk being disowned by their families, experience sexual and gender-based violence at home and at school, and that it's so important that programs be working with youth to reduce stigma among these people in their lives, be it parents, guardians, or other family members. And also work to scale up and sustain comprehensive sexuality education in schools. Next slide, please. So some other insights that I'd like to speak to here include the finding that we really need to be more intentional in understanding youth and understanding their different identities. It's important, as was said earlier, that they're able to self-identify and that we're more inclusive in the different surveys and other materials that we develop so that youth can see themselves reflected. It's also really important that we acknowledge that SOGS terminology varies greatly according to audience, purpose, and context. Even within the same community, SGM youth might be using different language amongst themselves than they are with others. And this can sometimes be a protective strategy. Next slide, please. So now I'd like to spend the rest of the time really focusing on these priority actions that we developed from the insights. First and foremost, it's absolutely critical that program implementers prioritize local leadership and ownership when designing, implementing, and evaluating programs. In any country in the world, there are sexual and gender minority people, and there are also organizations that are operating to support these communities. So it's important that from the start, we learn to identify these communities and cultivate relationships that allow us to be partnering with them throughout project implementation. Next, as was mentioned earlier, well-being, safety, and security must be our main focus. So in partnering with SGM-led, SGM-serving organizations, as well as SGM Youth, we need to ensure that we're conducting risk assessments and developing safety and security management plans. These are things that we should do in partnership with SGM organizations and youth. And these risk assessments can help us to identify real as well as perceived threatening organizations and youth. You can think of discriminatory laws and policies, local actors that might perpetuate stigma, prejudice, etc. It's important that staff be trained on these assessments and also that they be revisited throughout project implementation in response to any changes in the context. And these assessments will then support our conducting of SGM inclusive situational assessments. There's so many great tools around there for conducting gender assessments and other types of situational assessments. It's so important that we put an SGM inclusive lens on those. This will allow us to better understand the enabling environment in which we're working and what is and isn't possible. And I want to emphasize, it's always possible to do something. It's just how we do it. In some contexts, it might be possible to be more overt, more publicly open with our efforts. In other contexts, it might need to be more covert and done more locally and in partnership with organizations, so as to protect safety and security, first and foremost. Next slide, please. And I'll end with highlighting a couple of the actions that appear here. It's so important that as we're developing program activities and materials, that we integrate SOGIAS diversity and also integrate diversity as it relates to the experiences of SGM youth across their intersecting identities. Regardless of whether or not a particular identity has been identified in that community, we need to recognize that these are young people who are learning about themselves and growing and changing every day. I could even speak to my own experience as a queer non-binary person. I didn't start out that way because I didn't know what was possible. But as I grew older and I learned more about myself and I saw models out there, I understood myself better. And youth deserve to have those opportunities to be able to learn about themselves in safe and supportive environments. I'll speak to this next action around partnering with influential groups. Stigma, prejudice, discrimination, violence. These are things that SGM youth have to navigate in their everyday lives, and no young person should have to. So it's absolutely critical that we partner with influential groups like parents and guardians and religious and faith leaders so that we can help to sensitize them to what is most important and critical, the health and well-being of youth and what we can do to support them. In the brief, you'll actually find some really interesting examples of partnering with religious and faith leaders who are more accepting and open and receptive to SOGIAS diversity and helping to change hearts and minds in their communities. And this is in countries in East Africa. And I say this because it's possible. It's just going to take all of us to make it even more possible and scale up. And last but not least, I'll speak to this action around creating opportunities for meaningful engagement and leadership among SGM youth. Yes, of course, it's absolutely critical that we're partnering with SGM youth throughout project implementation. And it's also important that we create opportunities that allow them to be themselves in safe and supportive places. As I've spoken to, there's so much adversity and so many challenges that SGM youth face every day. And they're incredibly resilient and also deserving of joy. Through our programs, we can create these safer, supportive spaces for SGM youth to get to know themselves, to get to network and play with other SGM youth, to be able to foster their own professional and personal development. That's something that's possible and something that we can offer. I'll leave it there. I know I didn't speak to all the actions, but again, this is just a teaser because I really want to encourage you all to read the brief on your own, to share it with your colleagues, and to even think about what might be missing from this brief that can support our work going forward. Thank you so much for listening to me today. And now I'd like to turn it over to my colleague, Amanda Farr with Agency for All.
Thank you so much, Danette. I really appreciate that. A quick reminder as we open up this panel that there is a Q&A function through Zoom that we would like you to enter any questions or comments that you have through that function. And while you are entering your questions, I just wanted to start out by thanking our presenters and the large teams that are behind this truly important work, particularly as it is June and many of us are celebrating Pride Month. It's just so important for us to remember the intentional work that goes into fuller inclusion for transgender and gender diverse individuals. We know that meaningful inclusion doesn't just magically happen without efforts like these to move the standard and increase safety for participants in family planning and sexual reproductive health research and gender and programming. And as Danette said, it's possible. It's just going to take all of us to make it possible. I really appreciated that. So with that, I wanted to start out by asking our panel to think about recommendations for how you or your program can just start to become more inclusive of sexual and gender minority people and SOGIESC diversity. Sonal, could we start with you?
Yes, thank you. Thank you for that question. Yes, I think like Amanda, to begin with, it's really important that we look at actively, consulting with the community. Whenever our programs happen, like, the entire process, beginning, during, after. So, this would kind of mean that one is, of course, the decision-making processes, the planning of a project, the actual implementation. And I think like before even a program kind of starts or any kind of work starts, it's so important to have a policy in place which protects any individuals who would be engaging with you in these programs. Because, we may have trained a lot of staff, but turnover kind of always sort of exists. And it's not necessary that every staff who comes in is sort of gender trained. So it becomes always important to kind of constantly have like a safety blanket with a policy to address if there, comes about any issue in the process. And hands-on, like I just mentioned, so important to like continuously do trainings. We advise that, of course, like, it's good to any staff who comes, like, let there be an orientation when it comes to gender. And not just like orientation, even for staff, it's important, like, over a period of a few months, at max 2 years, constantly like kind of do refreshers with them to keep them kind of, updated through the process. Yeah, those are some, like, I think, excellent ways to just get started at least. Yeah.
Thank you so much for that. I really appreciate it. We do have a question in the Q&A of asking if any of these organizations here or any that maybe you're familiar with in the work that you have done have targeted safeguarding, so mechanisms of the gender minorities or sexual and gender minorities, and if anyone can share on any information that you might have on targeted safeguarding for these populations. I don't know, Danette, if you have anything that you'd like to add for that.
Hi, Amanda. Sure, happy to speak to that. So of the organizations that we learned about through our learning and assessment activities, yes, absolutely. It's critical to have in place safeguarding plans. And it's critical also to be training your staff on what those plans are. As we're seeing today, there can often be a lot of swift changes in legislation that have significant impacts for sexual and gender minority people. So having these plans in place allows an organization or a program to be able to know where to begin as these changes happen in their context. Importantly, it's also I would say it's also necessary that when these changes happen and when you revisit your safeguarding plan, that you're doing that in partnership with SGM organizations and SGM youth, so that they can also be speaking directly to what it is that they're experiencing on the ground and what then needs to be done as follow-up actions. I'll stop there and would invite other panelists to share some of their own experiences.
Yeah, Innocent, I don't know if you have anything to add, or Sonal, anything else?
Yes. Oh, I heard you called me Amanda, right?
Yes, go ahead.
It looks like I can't open my video. It says until the host has to allow me to open. Uh, Great. But yeah, I think I also have a few recommendations to that. And my point would be emphasizing again on the importance of protection. Just going back to what my colleague Danette was sharing about the list of recommendation that has been made on the technical brief. And speaking about protection, I think historically there have been a little bit of improvement in terms of how do we partner with organizations that are working on section gender minority, increasing a little bit of funding scope to them, but there have been less efforts in terms of protection, and because these groups have been supported to implement the work, especially like SGM youth in our context, then their work have developed a kind of reaction. That's why we see a growth of anti-rights movement from people who are responding to that. And I think it's time we also increase the focus in terms of building protection pathways for the group. And I have a few recommendations in terms of the protection pathways. I think one, I would love to encourage international agencies, especially state member organization. Sometimes they're more protected. So for instance, I'll give a scenario in Tanzania last year where there was a big rise of anti-rights movement, and the target were civil society organizations working to promote section gender minority inclusion. And when they came to interrogate colleagues for that, imagine if there was only one technical staff from the World Health Organization during that interrogation saying what they're doing is actually evidence-based, would have reduced the scrutiny from the government towards the group. So that would be one of the protection pathway. So having international member state organization just being there in terms of being around when things are happening, and them being vocal because they know it's evidence-based and it's actually working. So I think that's one of the very strong way I think we may reduce backlash. And then one more quickly is around influencing intergenerational collaboration, especially like for the youth. That's one of our big agenda here. So having, especially for us working on youth-led organizations, how do we partner with our senior professionals who have been working in the field, finding pathways to make these groups work together to have a better outcome. Sometimes it's a little bit, we're quite separated, so we work just alone and then they work only by themselves. So how do we influence meaningful intergenerational collaboration? And I think I'll pin that recommendation to one of the programs I wanted to share, like the building leadership capacity of young section gender minority activists and leaders. When we build their capacity, we raise the self-esteem. We provide them a platform to actually be confident in speaking their needs and for them to be listened. And that way, I think we may come up with very strong outcomes in terms of engaging section gender minority youth in family planning programs. We can't assume their needs, but when we build their leadership skills and meaningful engage them, I'm sure would have a good outcome. And we saw that, I mean, from the Young Life Fellowship in Tanzania, we see for the first time, fellows are being invited to speak in the Global Area Adolescent Study Forum. Last year, we did this together with the natives and the team, speaking within the Young Alive National Summit, where they're speaking their issues, they're speaking what matters to them. I think that's very important, finding those pathways to influence meaningful intergenerational collaboration, but also member state organizations, UNFPA, WHO, be there and tell them to be loud as well when things happen. I'll stop there, Amanda. Thank you.
No, that's wonderful. It actually touches on a few different comments and questions in the Q&A. You know, one talking about safeguarding with an eye towards institutional protection, not just for participants of these programs, but our staff and our consultants. And I think that's a really important point, is that when we are building the capacity within our institutions with individual youth or other individuals who identify as sexual and gender minorities, that we are then bringing those voices in for our organizations and our institutions as well. So now, I don't know if you have any thoughts on that as far as staff or consultancy safety as well.
Yes. So I think you're absolutely right. When it comes to safeguarding, you have to look at multiple levels, and that includes internal frameworks, policy frameworks. It's really important that you have a kind of protection policy of how you want to work with, similar to how you would work with children for LGBTQI plus communities as well. And it's also very important to look at, how will you deal with instances of sexual harassment or abuse that may happen within the setup, because this is something which is a common experience of transgender sort of individuals. And not just that, like what happens when there is a client and service provider interaction, which could turn abusive. So, at multiple levels, we have to look at a safeguarding system. Other than that, another thing that came up in our sort of research was not just like the client and service providers or staff, it's also the institution or the, I think like the administrative framework as well. So for example, if an organization is working with these communities, especially in high risk situations, so there is possibility of violence and attacks, on these organizations as well. So before even a project kind of starts, to assess the risk, for the organization, for the staff, for the communities. And even further in, when you go in data, how you protecting data? Do you have a proper policy in place to protect data, of these, of the individuals?
That's so great. Thank you for that insight. Danette, I was hoping that you could address this question in the Q&A. How do we really plan to engage minority groups or transgender, gender diverse individuals when some people aren't even coming out? So how do we reach populations and engage with them when they may not be out?
Absolutely. That's a really great question. And this is why it's so important that as we're developing programs and the materials, that we're as inclusive as possible. Because by being inclusive in those materials, it creates that opening for people. It allows them to see that there are other ways of being an individual. It allows them to understand that there are other gender identities, that there are other sexual orientations. And so if folks are learning about themselves, they have models of other ways of being that are outside the sex gender binary that might actually feel like they're better aligned with them as an individual. I would say that's the first thing, right? We're not here to out anyone. We're not here to force disclosure. In fact, that's actually abusive behavior that often happens a lot in healthcare settings and other places. So that's really critical and should be a part of safety and security as well. Thinking about how is it that we can be as inclusive as possible to create that space to create and so that youth in their own time can disclose themselves and we can know that they are in a safer place to be able to do that. And I say safer because no safe space can ever be guaranteed. And I think my colleague Sonal and Innocent can speak to that much better. Well, we can all speak to that if I'm being honest from our respective contexts. So I'll leave it at that. And Innocent and Sonal, if you have other things that you can share specifically from your experiences, please do.
Maybe I can go first, Sonal. Yeah, I think also adding to Danette's point. So personally, I'm a strong believer that no one belongs to the closet. The closet is hard in one way or another. Though, people do stay there also to remain safe, especially in challenging contexts. And we really have to be careful. How do we, how do we create safe space for reaching the needs even of those who are in a closet and who have not come out yet? I think as organizations who are joining today and actors who have joined today, I think there is a way to find to create more safer spaces where even young sexual and gender minority youth who are in closet feel safe to engage. For some reason, even people in closet, they're struggling and looking for safety and for speaking up their needs. And I think creating safe spaces does not mean you say we are pro-LGBT, we have a rainbow flag, but it's also individuals. How do we behave when we're talking to people? How do we share even basic family planning messages? Sometimes our messages are very heterosexual packaged when we are communicating issues around sexual and reproductive health and family planning. How do we ensure the language also we individuals on how we engage? So I think it's honestly a hard thing, but at least it first starts by recognizing a responsibility of creating safer spaces for everyone and start channeling our conversations around family planning by understanding the value, upholding ethos of human rights and not of heterosexual scripts of family planning messages that we promote. So we should focus our messages with a human rights approach that everyone can feel safe to learn from that message, regardless of who they are, regardless of their background. Maybe that would be a better way to also reach people who are in closet and the environment that made them to be there.
Thank you so much. So now we only have about 1 minute left. So I was going to ask you to wrap up this panel with the idea of, we're doing this work and we want to see things progress, but how should the success of this inclusivity effort be measured in our research and our programs? How do we know that we're being successful?
Okay, I'm going to try to tie in answering what I wanted to say about the previous question in this one.
Excellent.
I think when it comes to coming out, I think there's a lot of, like Dennett said, undue pressure sometimes put on communities or even the way we are questioned to come out. But actually, if I put it really simply, what is coming out? Coming out is sharing a secret. And for anyone who's held a secret, we will all know that we only share secrets with people we finally, can trust, right? And how do you build trust? How do you trust someone? It shows in their actions. That's how trust is sort of built. So if I kind of replicated it to an organization, how can I show trust to these communities? That's by showing what I stand for, whether it's my policy or my, the space that I'm kind of creating, giving, and this is something I have to say to organizations, like you cannot expect communities to come out in a closet, in an organization that is in the closet about its stand towards these communities. And if you talk about like programs and inclusive efforts, coming to your question, like how do we know something has succeeded? Like, there are qualitative ways and quantitative ways. Quantitative ways will show you that, okay, there's been an increase in access. More people are coming, stepping in, they're telling you about different needs. But qualitative would be communities saying, I'm feeling safe here. I can bring my family here. I can tell you more of my secrets because I know you'll hear and you'll help me with this, So yeah, that's just putting it simply. Thank you, Amanda. Over to you.
No, thank you so much. And to our panel, this was such a great conversation. I know that there are more questions in the chat, but our contact information will be shared with this as well. For more resources and any kind of connections that you would like to make, please reach out to us.
Wonderful. Thank you so much to our outstanding panelists and moderator, and for the phenomenal questions coming in from all of you. I'm going to pass it over to Danette to share an upcoming Breakthrough Action event and some closing remarks.
Thank you so much, Brooke, and thank you as well, presenters. So I'm really excited to announce that we would like to have a follow-up engagement with you all around our technical brief. We're actually going to be hosting an applied learning workshop specifically around this brief in July, and we are currently promoting the expression of interest form and inviting you all to submit this form by Sunday, June 23rd, if you are interested in being considered for participation in this applied learning workshop. So I've put the link in the chat, and also please know that we'll be sending a follow-up email around this webinar with recording slides, and we'll also include this link to this expression of interest form. Please feel free to share with other colleagues who are not on this call, but would benefit from an opportunity such as this. Next slide, please. And last but not least, just to close out, honestly, I think we probably could have closed out with Sonal's words at the end of the panel, because those were just so powerful and insightful. But I will say this. This is a collective effort, and it's needed to achieve and sustain opportunities and rights for sexual and gender minority people around the world. We all have a role to play in fostering acceptance and inclusion for sexual and gender minority people, and also for SOGS diversity more broadly, as well as diversity in all its forms. Returning to the individual and group reflections that I know we're all having, acceptance and inclusion starts at home. It starts where we're born, where we live, where we learn, where we work, where we play. I think you get the point. So it's really important that in our relationships with people that we're advocating for inclusion. If we hear a slur that's being directed at someone, that we're stepping in as a bystander and letting folks know that that's not okay, that it's disrespectful, that it's not valuing that person and who they actually are. This is what we mean by it takes all of us. It's not just about what we do in our programming, but it's about how we live our lives, accepting and respecting people in all their diversity. And USAID's inclusive development policy really helps to outline the ways in which we can have this more equitable development approach that builds on this understanding that every person of all diverse identities, backgrounds, and experiences is instrumental, is necessary in order for us to transform our societies for the better. Thank you all so much for joining us today, for your thoughtful questions, and we look forward to continuing to do this work with you all.